Generic medications are produced to replicate the original branded medication. So they have what is termed bioequivalence, that is that they have the same core constituent and they will have the same effectiveness for the condition they're prescribed for, and they will also have the same risks and benefits. So it can be confusing when looking at generics and original branded medication, as they can have different packaging, can have a different shape or taste or feel. But it's important to recognize, once they've been approved by the regulatory agency, that they have the same equivalence and therefore are similar effectiveness. The Irish Medicines Board is drawing up a list of medicines that will be interchangeable, and they are prioritising drugs that consume the largest portion of the national drugs budget. With that in mind, the drugs that they are focused on in the first few waves will be statins for high cholesterol, ACE inhibitors for high blood pressure, proton pump inhibitors for stomach ulcers. So that these will be the first of the medications that patients will see when going to the pharmacist that will be swapping for generics. There will of course be times where it may not be appropriate to substitute a branded medication for a generic, and this is allowed for under the Act, with what's naturally called a do not substitute order. What this means is when the patient is being prescribed a medication by the doctor, that they can write do not substitute on that prescription. So when the patient goes to the pharmacist, they will receive the original branded medication, it won't be substituted. And it's important to note that the patient won't have to pay any difference. With the changes brought in by this Act, it will be important to recognise for me as a prescriber that there will be medications, there will be a change in the dispensing practice. So there are certain medications, such as we mentioned already, statins and high blood pressure medications and stomach ulcers, that will change. So for the patients that I see who either on a new prescription or on a repeat prescription have these medications, I just need to let them know that there may be a change when they go to the pharmacist, and that they may receive a different generic variation on the original branded medication, and that this is not something to be frightened about, that they all, once approved by the regulatory agency, have the same equivalence and the same effectiveness and the same risks and benefits. And of course, if patients or relatives need any further information, that they can ask their doctor or their dispensing pharmacist.